Diastasis recti causes abnormal abdominal volume, back pain, and pelvic floor dysfunctions. The physiopathology is based on the irreversible weakening of the linea alba and the consequent reduction of support of the abdominal wall. Dr. Darecchio's robotic transabdominal preperitoneal procedure cures diastasis recti with the orthotopic reconstruction of the linea alba. Fluorescent 3D vision in modern robotic platform reproduces a clear real-time image of the intramuscular vessels so they can be respected during the suturing. The reconstruction reproduces with high fidelity the natural anatomy without any position material touching the bowel or under the adipose panniculus. For this reason, common risks of other techniques such as bowel adhesion or perception of foreign body under the skin are avoided. Over time, the linea alba remnant fibers consolidate to form a new orthotopic linea alba, while the mesh is reabsorbed in the preperitoneal space. Post-surgery, the abdominal wall provides a correct visceral and spinal support and regains a full free movement range compatible with the highest sports performances. The recti muscles start to work in a physiological condition, and over time, they shrink to their original length of before the diastasis, which results in additional flatness and definitive, beautiful shape of the abdomen.